Welcome, curious minds. Today we're looking into the remarkable world of facial surgery and how mathematicians in Germany harness the power of triangles to revolutionize the field. Get ready to witness the incredible intersection of mathematics, computer modeling, and surgical precision. Now, that's a wild statement for somebody like me who really doesn't enjoy biological sciences, but get ready. In the past, there have been times in which surgeons have been faced with the challenges of predicting surgical outcomes, especially with patients that had facial malformations that they had to repair. They had the issue of predicting what the face would look like after. For this reason, in 2006, a team of German applied mathematicians, Peter Delflaert, Martin Weiser, and Stefan Zachau, stepped in to change the game. These three men began their journey by using advanced imaging techniques like computerized tomography, CT scans, MRI, or magnetic resonance imaging to create detailed three-dimensional maps of a patient's facial bone structure. Now, these scans allowed them to build an accurate computer model of the patient's face. They incorporated realistic estimations of skin and soft tissues. Even material properties like fat and muscle, tendons, ligaments, and blood vessels were incorporated. It was a pretty wild thing. Now that they had this biomechanically accurate model, they embarked on the virtual journey. They started simulating complex procedures. In the same way that a fighter pilot sharpens their skills in flight simulators, surgeons could now manipulate virtual bones. They could cut, they could relocate, augment, or remove sections, and they could see how the soft tissues, that is the soft part of the face, this goes into soft body physics, they could see how those soft tissues would then respond to those changes. These simulations provided invaluable insight for surgeons. They alerted them to the potential risks or adverse effects the procedures could have on delicate structures like nerves, blood vessels, and the likes. Even more, these simulations predicted how the patient's face would look after the surgery, and many was very, very accurate. Now, this is what you've been waiting for. The power of triangles came out again in this process. The researchers used triangles to model the two-dimensional surface of the skull, and they used a 3D counterpart of triangles, tetrahedrons, in modeling the three-dimensional soft tissues of the face. It was that interconnected meshwork of tetrahedrons and triangles that could help them understand how the face would deform and adapt after surgery. Just like rubber or spandex, the soft tissue exhibited spring-like properties, and the simulation algorithm updated forces and moved tiny tetrahedrons accordingly, ultimately setting the tissue into its predicted new equilibrium state, essentially how the face would look after surgery. The results were astonishing. When tested against clinical outcomes of approximately 30 surgical cases, the model proved highly accurate. In fact, it correctly forecasted the position of 70% of the patient's facial skin to within 1 millimeter. Only a small percentage deviated slightly more than 3 millimeters from the predicted outcome. Just look at this remarkable example. The before and after comparison showcases the precision and effectiveness of this computational approach. Who would have thought computers, graphics would actually come in play in medicine? Amazing. And there you have it. That's a glimpse into the world of triangles, mathematics, surgical innovation. It's an amazing thing. Thanks to Steven Strogatz, who first introduced me to this idea in his book, Infinite Powers. Thank you very much for watching. Have a nice time, guys.